Hello, everybody, and welcome to a new content related to the PT license preparation and with Dr. Kamel. If you didn't see any content for me before, my name is Dr. Kamel. I'm working as an associate professor of physical therapy in United States, and at the same time, I'm a registered licensed physical therapist in United States, UK, and Egypt. So let's see what is content today is about. A 56-year-old man presents to the physical therapy clinic with complaints of increasing shortness of breath during daily activities and chronic cough. On observation, the therapist notes bulbous enlargement of the distal phalanges of the patient's finger and a spongy quality of the nail beds. This is a description of something. The patient's medical history includes long-term cigarette smoking. Okay. Which of the following underlying pathologies is most likely associated with this physical finding? So actually this physical finding is mainly, we call it clubbing of fingers. Clubbing of fingers. So you are examining and evaluating a 56-year-old patient. This patient has complaints of shortness of breath, chronic cough, and the patient is long-term cigarette smoker, and you find this finding of clubbing. So this clubbing is usually associated with lymphedema, pulmonary disease, chronic venous insufficiency, complex regional pain syndrome. Okay, and what is the correct answer? So the correct answer is number two, pulmonary disease. So digital clubbing is the most commonly associated with chronic pulmonary disease. Why? Because with pulmonary disease, and if it is chronic condition, will be associated with long-term hypoxia. Hypoxia means low oxygen delivery to tissues. Okay, and uh, so with chronic hypoxia, which is happening with chronic pulmonary disease, what will happen? There will be release of platelet-derived growth factor and vascular endothelial growth factor. What will be the consequence? There will be increased blood flow and connective tissue proliferation at the nail bed, which will result in clubbing. So again, chronic pulmonary disease or chronic respiratory disease will lead to chronic hypoxia. Okay, with chronic hypoxia, what will happen? We will have increase in platelet-derived growth factor or PDGF and vascular endothelial growth factor VEGF, and accordingly we will have increased blood flow and connective tissue proliferation at the nail bed, which will result in clubbing. Okay, what are the common pulmonary causes for this finding? Cases of lung cancer, especially bronchogenic carcinoma, bronchiectasis, cystic fibrosis, lung abscess, interstitial lung disease, chronic hypoxemic COPD, and what is the finding when we are doing physical examination? How we can differentiate clubbing of fingers? We will find enlargement of the distal phalanges. We call this finding drumstick fingers. We will have also loss of normal angle between the nail and nail bed. We call this Lovibond angle. Okay, and we will have spongy or floating nail bed on palpation. So these are the physical finding upon physical examination. Let's look at the incorrect answers. Lymphedema. Lymphedema is a chronic case, incurable, non-curable case, will be associated with localized swelling, which is due to lymphatic obstruction or damage. And usually, lymphedema happens after mastectomy, infection, or trauma. Okay, it will not cause clubbing or changes in the shape of fingers. So usually the finding with lymphedema will be non-beating swelling, skin thickening in the later stage, because lymphedema will go through different stages. So brownie appearance will be on stage 3 and above. Chronic venous insufficiency is a condition affecting lower extremity, not the fingers. And there will be incompetent valves of the veins, which so blood will be going distal, but there will be a problem with the venous return or returning blood to the heart. There will be edema, varicose veins, and this brownish discoloration of the skin, which we call hemosiderin staining, due to iron deposition and iron fragmentation, and also ulceration. We might have venous ulcer, but there will be no clubbing. So again, with chronic venous insufficiency, we will find brownish discoloration at the ankles, venous stasis ulcer, leg heaviness. Okay. Number 4 is incorrect. Complex regional pain syndrome. So complex regional pain syndrome will cause abnormal thrombocytic nerve activity after injury, and the findings are pain, swelling, color and temperature changes, trophic changes of skins and nails, but there will be no digital clubbing. Okay, so what are the findings of complex regional pain syndrome? Again, burning pain, allodynia, which is pain to light touch. Skin will be shiny or mottled, so we will have these are the trophic changes, which we call them trophic changes. Limited range of motion. Okay, so in order to summarize, we have 4 options here. We said number 2 is a correct answer. Clubbing will be associated with pulmonary disease, in which there will be chronic hypoxia, will stimulate nail bed changes, connective tissue deposition, and so on. And the common findings in this case will be hypoxia, shortness of breath, and chronic cough. Okay. Incorrect answers: lymphedema, limb swelling, skin thickening. There will be lymphatic blockage, finger deformity, maybe. No finger deformity, I mean, no clubbing will be over there. Chronic venous insufficiency, leg edema, skin staining or brownish discoloration, ulcers, but there will be usually lower extremity will be affected legs, but not fingers, no clubbing fingers. Chronic regional pain syndrome, autonomic dysfunction, but no clubbing, pain, skin temperature changes or trophic changes, and that's it. So this sometimes also, in order for completeness sake, we might find clubbing with cardiovascular or heart problem as well. If you would like to join my PT license preparation course, please send me a message on this WhatsApp number 001-442-248-7206 or 0020-102-774-3702. And if you are thinking about joining the transitional DBT at University of Montana at a discounted rate, please send me also a message on these both numbers. And just I need to let you know that for the admission for the coming semester, spring 2026, which will be starting on the 1st of January 2026, the deadline for application will be this week, I'm sorry, this month, which is the 26th of November this month. So if you are planning to apply, please send me a message as soon as possible so I can send you the full requirements, paperwork needed, and so on. Thank you for listening and following my videos. Please subscribe to the channel so you can get every new video, and see you maybe tomorrow in a new content. Thank you.